In this video, we are going to talk about how many times should you ejaculate to keep your prostate healthy. So before starting this video, please like this video and subscribe to our channel for future updates. Over the years, there's been growing evidence of a link between ejaculation and lower chances of prostate cancer. But the 2016 results of a major study made the strongest case yet. The researchers asked men to answer questions about how often they ejaculated. How didn't matter, sex, masturbation, or wet dreams were all included. Then they tracked almost 32,000 of these men for 18 years. The researchers found that guys who did it the most, at least 21 times a month, had about a 20% lower chance of prostate cancer compared with those who did it less, 4 to 7 times a month. That was true in several age groups. The exact number of times didn't matter. Basically, the more men ejaculated in a month, the less likely they were to get prostate cancer. Despite the importance of prostate cancer, its causes remain unknown. Scientists do know that genetics plays a strong role, and they have sound evidence that diet and other lifestyle factors are also important. Since the prostate is a reproductive organ that produces fluid for the ejaculate, researchers have long wondered if sexual factors influence a man's risk of prostate cancer. But a Harvard study provides good news for sexually active men. The Harvard Ejaculation Study. The health professionals' follow-up study has been collecting information about a large group of volunteers since 1986. All the men are healthcare providers, including dentists, pharmacists, veterinarians, optometrists, ophthalmologists, and podiatrists. Ejaculations included sexual intercourse, nocturnal emissions, and masturbation. The volunteers provided comprehensive health and lifestyle data every 2 years until the study concluded in 2000. The scientists found no evidence that frequent ejaculations mark an increased risk of prostate cancer. In fact, the reverse was true. High ejaculation frequency was linked to a decreased risk. Compared to men who reported 4 to 7 ejaculations per month across their lifetimes, men who ejaculated 21 or more times a month enjoyed a 31% lower risk of prostate cancer. And the results held up to rigorous statistical evaluation, even after other lifestyle factors and the frequency of PSA testing were taken into account. Is there a link? Over the past almost 20 years, a number of articles have claimed that ejaculating more often can reduce the risk of prostate cancer. Some scientific evidence supports these claims, although results can be conflicting. A 2004 surveyed more than 29,000 men on their ejaculation frequency over a period of 8 years. It found that men with a higher ejaculation frequency, 21 times or more per month, may have a lower risk of developing prostate cancer than men who ejaculate 4 to 7 times per month. Frequent ejaculation, age, and prostate cancer risk. It still remains unclear whether or not ejaculating more often makes males of all ages less likely to develop prostate cancer. For example, an older 2003 study trusted source found that men who frequently ejaculated when they were younger appeared to have a reduced rate of prostate cancer later in life. In contrast, a 2009 study trusted source found that frequent masturbation might reduce the risk of prostate cancer in men aged 50 and above. However, the same study also suggested that ejaculating more often might increase risk among men in their 20s and 30s. A more recent 2017 study examined ejaculation frequency and the risk of aggressive prostate cancer. It found that a higher ejaculation frequency in a male's 30s was protective. However, it did not see the same effect for frequent ejaculation in a male's 20s and 40s. A piece of the puzzle. The studies from the United States and Australia do little to answer these critical questions, but they do open a new avenue for research. Since both report that a high frequency of ejaculation early in adulthood has the greatest impact on the risk of prostate cancer decades later, they call attention to the role of events early in life when the prostate is developing and maturing. There is certainly precedent for a long lag between cause and effect. For example, childhood sunburn is a major risk factor for malignant melanomas in adulthood, and prenatal factors that influence birth weight appear to influence the lifetime risk for hypertension and heart disease. There is no medical guidance on how frequently a male should ejaculate. More frequent ejaculation in sex can offer numerous health benefits, such as managing stress, relieving pain, improving heart health, and reducing high blood pressure. Some research suggests that ejaculation may help to reduce the risk of prostate cancer. However, more research is necessary. So this is our today's video. If you like our video, don't forget to subscribe to our channel or hit the bell icon. We will meet again with another interesting topic. Till then, stay safe and stay happy.